Hello, my name is Michelle Vaden. I am from Tarleton State University, and I will be presenting a presentation on behalf of my classmates, Katie Kundrell, myself, Michelle Vaden, Stevie Wylett, and Ashley Lawley. Our topic today is Candida albicans, a fungi of veterinary importance. Candida species is a genus of yeast, which is also known as a fungi. It is eukaryotic, unicellular, round or oval organism. There are more than 200 species in the genus Candida. Where does Candida normally live? Candida is normal flora in an animal's mouth, nose, ears, gastrointestinal, and genital tracts. This type of yeast is opportunistic and will sometimes colonize or invade damaged tissues of immunosuppressed animals. Candidiasis occurs when there is an overgrowth of Candida in the body. So how does Candida reproduce? During asexual reproduction, blastocandidia, also referred to as buds or daughter cells, develop. And three forms you'll find under the microscope are budding cells, which look like this, are oval with a bud coming out of it. Or you'll find pseudohyphae, which is like branches of yeast coming off of it. Or you'll find hyphae under the microscope, which are septi as well. Two septi hyphae. So the Candida species of veterinary importance, well, within the genus Candida, the species of veterinary importance and the cause of most cases of animal disease is Candida albicans. The animals affected by this organism, Candida albicans, are cats, both adults and kittens, dogs, both adults and puppies, cows and calves, horses, both adults and foals, birds, pigs, cats, and the diseases you'll find is rare in cats, but you'll find ocular lesions, urocystitis, pyothorax, oral disease, upper respiratory disease. Kittens also rare, but you'll find mycotic stomatitis. Birds frequently will be infected with Candida albicans, and it will get affected. The digestive tract will be affected. You'll find thrush of the esophagus in the crop and candidiasis of the cloaca or the vent as presented here. Puppies, mycotic stomatitis. Dogs, cutaneous lesions, enteritis, disseminated disease. And here are some images of an infected ear and skin as well in a canine. So with cattle, you'll have abortion, mastitis, reduced fertility, systemic candidiasis, calves, gastroesophageal ulcers, ruminants, disseminated disease. And here's an image of an infected mouth with Candida albicans. In horses, you'll have ocular lesions, fungal ulcer is presented here. Pigs, gastroesophageal ulcers, disseminated disease. So it seems like mostly all animals can be affected. Clinical signs. In the calves, you'll have watery diarrhea, anorexia, dehydration, gradual progression to prostration or death. Clinical signs in chicks, reduced feed intake and growth rate. Clinical signs in pigs, diarrhea, emaciation, and it affects the oral, esophageal, and gastric mucosal. In birds, you'll have infection of the mouth and beak can cause bad breath in white raised area called plagues with thick, clear, or white material in the mouth. The inside of the mouth has the appearance of terry cloth. Infections of the beak often occur at the commissure. If the infection occurs lower in the digestive tract, there may be depression, loss of appetite, weight loss, vomiting, and diarrhea. In the respiratory tract, Candida may cause nasal discharge, a change in the voice, difficulty breathing, rapid breathing, and inability to exercise. Symptoms in the canines: black, brown, yellowish, gooey buildup of debris in the ears, constant shaking of the head, skin disorders, rashes, bladder and urinary tract infections, hot spots, excessive scratching, genital rashes and anal itching, excessive licking, chewing of the paws, legs, tail, or other parts of the body, or allergies. As it continues on, you'll also find lethargy, anxiety, hyperactivity, overly hungry and underweight, overly hungry and overweight, hungry and underweight, joint pain and stiffness, which is arthritis, bowel disorder, thyroid imbalance, bloating, intestinal gas, cramps, inflammatory bowel disease, strong doggy odor, dull, dry, or a greasy coat. And here's a summary, more or less, of what I just went over, the animal affected and their clinical condition. So, how do we diagnose and detect Candida albicans in the laboratory? Well, culture and histopathology, of course. We take biopsy samples, tissue samples, milk samples, aerobic cultures. Skin cytology, stain with methylamine silver methods, ear swabs, or skin impressions. All methods for detection of Candida albicans. Treatment: often this condition is diagnosed as allergy, so it's misdiagnosed. But the treatment would be antibiotic, antifungal medications, anti-inflammatory drugs, or zoonotic potential. The Candida albicans yeast organism lives naturally in the human body, kept in balance by good bacterial flora. The same conditions exist within your dog's body or your animal's body, within the organism living within the intestines, mouth, ears, nose, and genitals. It is even possible, though, for humans that can catch the yeast infection from their pets, but only if they're not careful about treating their dog or animal and taking care of their own hygiene. Here are the references should you want to dig deeper into this topic. The references are included in this video. So I hope you enjoyed this presentation on Candida albicans, and thank you for participating.